Hope your night was cool. Still Ezinari Sinokorafo on the line, a healthcare therapist. Don't mind my slow motion of talking. I inherited it from my late mother. I have something to discuss with you this morning. It's about errors in management of asthma by affected person that can lead to death. This is about the mistake people that are having asthma make that can lead them to death. This story is a sad one anyway. A 36 years old lady lost her life during the summer holiday due to asthmatic attack. What really happened? The lady traveled with her family to one of her relatives' house. She traveled without her inhaler. The husband of the lady and the husband of the person they visited traveled to another place, leaving the two wives in the house with the kids. Days after their traveling, the woman started having the crisis of asthma. The other woman did not have the knowledge of her health condition. She was wheezing in her room due to the noise and the crying of the baby of the woman. The other lady woke up. On getting to the room of her sister, she was already in a dangerous state. She started calling the husband. The husband told her to rush her to hospital. Before she could reach to hospital, they lost the woman. What is this asthmatic attack all about? Asthmatic attack is a sudden worsening of asthmatic symptoms. What is asthma? Asthma is a tightening of muscles around the airway that does not allow the person to breathe well due to narrowing, swelling, the place is inflamed and start producing mucus. What can be the cause? Could be genetics, that is hereditary. It can be due to cold, allergens, pollens, dust, and all that. What are the symptoms one can be presenting and you know that the person is having an asthma? One is difficulty in breathing. The person will be having shortness of breath, will not be breathing well. Why is he not breathing well? Because mucus, something has blocked the airway, or something has been deposited in the muscles of the airway. Two, he starts having cough. Why? Because it's trying to cough out some of those things that is blocking the airway. It's trying to exploit out the mucus that block the airway. Third, you start having a wheezing sound. Feel. It's not a funny stage. The person is gasping for air. There's no much air in her muscles of the chest. The person is dying. It can cause difficulty in talking. The person will not talk well. The person will try to talk, but he could not talk. How do you manage this condition? When you find a person in that position, you sit the person down, clear the airway, loose tighten clothes, and get her inhaler. Don't use another person's inhaler. It could be dangerous. It can transfer infection to the other. What are the sign? What are the woman went there without her inhaler? What really happened to her? People could say that is out of carelessness. Some will say that is out of negligence on her side. It could be, people will say it's witch, village people, her own time. But what do you say is what really happened? We should be careful of how we manage our condition. We should be careful on how we manage our ailments. If say she wasn't careless about her condition, if say she did not neglect her condition, if say she went there with her inhaler, they wouldn't have lost her life. If say the woman she traveled to have the knowledge of the condition, she might have advised her rightly on what to do before the crisis. She may think that she may not have the crisis within that period, but you never can tell what will happen in next period. Therefore, we should always adhere strictly to instruction given to our care to us from our caregiver. Therefore, any guide given to you, you should adhere to it. You should not die of negligence by your side. You should not die of carelessness. We should always try our own best and leave the rest for our Creator. I'm a nurse. I care for you. Thank you.